Welcome to this inaugural session of the Got It Talks, um, part of our Got It Toolkit project, where we try to look at how co-creation or user involvement in general can build better digital tools. Um, and with me today is, of course, you, Nick Guldemont, here for an hour to talk about, both the future of digital tools, I hope, a little bit about the present, also about digital tools, and a little bit also maybe as a bit of a surprise to our viewers, our audience, our listeners, also about the past, I suppose, because there is a past here. Not a dark and gloomy, but at least a past that we should dive into. Um, but Nick, if you will, a few words about who is actually my expert today.
Yes, thank you very much, Lars, for the invitation. I think it's really nice initiative and important that we talk about how to make digital health solution work for people. Yeah, co-creation is important element, I think, of that. I'm Nick Goldemont. I'm affiliated to Leiden University Medical Center, as well as Sechenov Medical University in Moscow. I have a background on electric engineering and medicine. I was supposed to become an orthopedic surgeon, but I did the training, but I can talk a little bit about how my career developed in the direction of transforming healthcare systems, which I'm currently doing. So my daily job currently is transformation of healthcare systems, and internationally. So I'm quite active in China, Russia, a lot of Eastern European countries, and Brazil, Israel, Middle East, some countries. For a start,
Yeah,
yeah.
yeah, you certainly do get around. I mean, not necessarily in a time of Corona, but before. Um, but also, speaking about careers, I know, of course, that this is not the first time that you're, well, neither digitally nor virtually, or physically on a stage talk about digital health. You've been doing that for quite some time. But in the interest of talking about the future, as I alluded to in the beginning, let's talk about the past. When or how did you get started into the digital part of digital health? And how may that also play a role in how you see the present and the pathway to the future?
Yes, well, maybe it's good to tell a little bit about my experience from young career researcher, doctor, and as I said, my career started with medicine, and I want to become an orthopedic surgeon, and I at the time I was responsible for doing coordinating research on the department in one of the Dutch university medical centers, which is the combination of the university and hospital, university hospital. And I was supposed to doing my PhD as well, so I did this in parallel. And the topic of my PhD was prevention of amputation in patients with diabetes, which obviously requires a more integrated approach rather than only the OR and amputation. And there's also a process of rehabilitation often. So integrated care, different actors in the care process, and the role of technology or interventions were already at the early stage. I'm talking about 20 years ago. Were part of my sort of research activities, my interest. Um, and typically, so this sort of doing work with other stakeholders in the process and with the patients on how to see how we can improve processes of care was inherently in my work. And people have to understand that at that time it was not so very obvious to do this, especially from a hospital perspective.
Maybe also to remind people, what kind of smartphone did you use in 2000?
Well, it was not very smart, I suppose. It was only, had the first introduction, so you had buttons to press the number, sort of LED display where you could
No
see the
touch
number
screen.
or the number who called you. And I think
Yeah.
even messaging was still at a very rudimental. So technology in that sense was not yet a very part of the process. Although
Mm.
website and internet was of course available, but in a very bulky, cumbersome way. It was not very smart, just information. Um, and um, well, this sort of engagement with actors in the process, I applied also to other research projects of the department. So I partly my work for the department in the research was to engage with stakeholders, see how we could build new projects, and usually this involved like industry, patients, of course, colleagues. Um, and again, this was relatively new in the way how I did it. Because I was quite open also to invite colleagues from other departments, which in a very fragmented organization like a hospital with all kind of interest in getting research money and keeping money for yourself and benefiting from it is very still also today quite a problem. So my approach in engaging with all kind of organization outside the hospital, outside the university, and building projects was something new. And in 2000, the topic of open innovation was upcoming. So open innovation at that time was new. It was a new concept, and especially for universities and an organization like a hospital. And so organically, my sort of activities grew, and the board of the hospital said, "Well, why don't you do this for all the departments? Start your own department for focusing on building projects." There were already some technology offices, but they were mainly focusing on legal aspects and on licenses and patents, etc., but not on how to build a project from an idea inside the organization or outside the organization. And so we built basically a sort of desk in the hospital where researchers or colleague doctors could put their ideas, problems, challenges, and my team, which was a multidisciplinary team, would screen the problem, see, okay, is this a sort of promising theme for research? Is it a societal impact or a business impact? Um, and the same sort of desk we had on the outside. So the industry could come, okay, we are looking for an expert this or for facilities, equipment for doing that. And gradually we were building a sort of network inside the hospital, outside the hospital, and also capitalizing on the sort of um, yeah, also the assets of those partners, because we engage with Philips, with some of the research organizations outside the hospital, with different facilities, different laboratories, different expertise. So we by doing this, we were standing on shoulders of others in terms of facilities, in terms of expertise, etc. The key element to the access was finding funding. So me and my colleagues were quite good at writing proposals, getting the money in for doing the execution of these wonderful ideas, um, and also to attract investments. And that concept grew bigger and bigger. And if we looking back, it was the sort of first element of the first example of a living lab, of what now called living lab. At that time, I think the word didn't even exist, or even co-creation was something which was only used by early stage designers. So a lot of things about design processes, how to bring people together, what type of sort of tools you use for communication to do understanding between different disciplines, um, were to develop. And we did it in a sort of intuitive, organic way. And obviously, it was not myself only, but so, and there was actually the sort of experience of co-creation, started.
Mhm.
And gradually, of course, it developed. And now
Would you
coming
like?
to the technologies.
Yeah.
Well, yes, ask a question.
Well, it's just you touch upon a number of elements that the interdisciplinarity, working cross-sector, ideation, finding the funding. I would think that some of the people that now know uh, the concept of a living lab are struggling with indeed those four concepts still. So in a way, also, it's interesting that would you ascribe this to also simply, if you will, luck? How did the stars align that it was possible? Luck, Nick, or uh,
Well, maybe.
hard
Well,
work? Doing
it
stuff
was,
that we haven't tried before, that nobody's tried before. How do you do it?
well, I think partly it was also because the board of the hospital and initially the departments, they were supporting me in, well, giving the flexibility to experiment with different approaches and allowed also early failures. But especially the director of the board of the hospital, he was convinced. I think your way of approaching these collaborations and sort of creation, I believe in it. So he gave his mandate, and this also provided an opportunity to engage with the legal department, for example, in the hospital,
Mhm.
or to make use with of facilities like laboratories for experiments. Um, so that I think was an important success factor, that you have a sort of mandate, and in relation also the sort of access to available expertise in order to make it to work.
Would you, based on those early experiences, how can you how can you sometimes then fight for that mandate? What did I mean? It might become, or it might be seem more obvious these days that, of course, a hospital would have a digital health department, or it would be on the strategy framework somewhere. Um, but sometimes you also, I guess, have to fight for the mandate of what that includes. We're going to be talking a bit more specifically about co-creation, but that's one of the reasons why I'm asking, because doing stuff you're not used to doing, that sometimes will require you to extend the mandate of what you're doing. How did you do it then? By numbers,
Mhm.
by ethics, by um, charm, maybe?
Well, maybe a mix, but definitely. So in these sort of first projects we did according this sort of approach, was that we showed the sort of benefit, because it was academic setting. It was, of course, if you show a benefit for science, it is appreciated. If it's a societal impact, well, it also they see, okay, it's part of our sort of duty to provide societal impact. But business wise, and this in the academic environment is either through contracts or maybe even to revenues. And the first projects we did actually were quite turned out to be very well on those three sort of indicators for benefit for such an organization. So because apparently I was able to explain, so how does it work and what kind of impact it could have, people were convinced. And we had the projects to show it. And at the time, there weren't much, I think, examples available. So I think that's definitely one element of obtaining the mandate. It's the combination of proof of concept and of course communicating, and I think also especially directing the right persons is helps in this respect.
Yeah, I would believe that it would. I guess it can be tricky. It's just as it's hard for children to choose their parents. It's can be hard to choose the right environment to be in. But fighting for it to transform it can, of course, be a thing that you work on for years and years.
Hmm.
But coming from that early experience, maybe, and as most of our audience will be aware, of course, digital health has transformed itself a little bit, or has progressed from smartphones, or well, not so smartphones with buttons, into touchscreens, or into some very savvy, actually, digital devices able to monitor a whole range of actually stats and data on not just the patients, the citizens, the hospital, the performance indicators, an explosion of data. So in now your key areas of focus in digital health, if you should name three or four, what from that early experience, what are you focusing on now? And especially, I suppose, if you will, there must be differences when you work in both Leiden but also in Sessionau. How this that is that really worlds apart, or would you describe it as surprisingly similar? Or
Uh, so currently my sort of digital lens or focus is at the sort of realization of transformation. So how can we use technology and digital in order to provide better care at lower cost? So in this sense, digital is more like an enabler or a support tool rather than the sort of main topic or starting point. Um, if I go back in the past, so in the medical field lab, which was my department, so we did a range area, pharmaceuticals, 3D printing. So we built the first 3D printer on low temperature in the world in the lab 15 years ago. New type of pharmaceuticals, drug delivery systems, but also digital solutions. And at the time, it was very bulky and well. And so we had this early stage sort of digital solutions like monitoring of cardiovascular patients at home, etc. Doing tests at home and through the internet, you upload and generating insights, but also building simulation models, prediction models for infectious diseases, which is currently quite relevant. So we did a whole range of topics. So we had in 10 years maybe more than 200 projects, innovation projects in this pharma, medtech, digital and healthcare health services. I moved after 10 years to a different university, University of Technology, focusing on personally in my research on e-health and digital. So and there we work typically on digital solutions for healthcare, for long-term care, for more convenient products related to health, like company like Philips, Medtronic, Samsung, etc. So I think in this area and this co-creation at that time, and I think it still is, it's very product oriented. So organizations, designers, developers are very, I think, capable, and we have enough examples on building products and a bit related services which are very user friendly and integrated.
Yeah. So let me ask you, for instance, about that. If you should describe a few, I don't know, whether you think of them as that, but a few principles perhaps for co-creation. What I mean, we quoted you on co-creation as that it sometimes could seem as if it's more like a tick box than as a real process. But when you try to do it, if you will, with the heart and mind in the right place, what are some of the principles that you use to make sure that that co-creation also unfolds in the best possible way?
Yeah, no, definitely. And this is so this sort of product-oriented design or development of digital solutions. It was developed over the last decade quite strongly, and able to develop really nice products and maybe interfaces. But now we come to healthcare, and usually when you're talking about creating health solutions from a more integrated perspective, that a product has a role in a total process of care, then you come to an important element which is often missing. And that's designers, industry are well equipped to develop person-friendly solutions for their products, but as soon as it has to be implemented in a sort of service structure which comprises different actors, different organizations, different systems, we come here to a problem where the current co-creation sort of ideas are limited, because the sort of co-creation typical industry designers and often also researchers is focusing on very small elements, while the context of use in healthcare is often much more broader. So and that was a little bit behind this provocative phrase, because industry and researchers in innovation manager do take in account co-creation, but not usually what is necessary to make it work in healthcare processes, specifically on person-centered care and multidisciplinary teams, etc.
Some developers, I mean, extending your scope that you ensure that you actually are covering all bases and a large number of users. I mean, some developers might also find it a bit daunting sometimes to actually access users, to have a, I mean, sometimes, I'm not pointing any fingers here, but sometimes some of these hospitals or doctors might also be gatekeepers, and also with a very strong lock on that gate. I mean, how would you perhaps advise some of these developers to find more suitable manners to ensure that the scope does indeed get bigger? And of course, there's a balance between the commercialization and the service here.
Yeah, right. So one of the lessons or the principles is that at the co-creation you apply to product development is different from if you're looking more from an integrated context, complex context related sort of solution. And usually in universities or design academies where they teach a sort of design approaches, you see there's an overwhelming a lot of attention to product development and not so much to this context-specific complex environment systems co-creation. So these are elements to take in account when you're talking about transforming healthcare. And one of the reasons why this is more different and more complex, one of the reasons is what you mentioned is you're talking also about sort of different position from examples from users. So when you co-creating products, you could invite a surgeon, a doctor, a nurse, etc. From sort of personal interest and can tell you what to improve. But if you're talking about a system and where you're dealing with maybe a professional group or another sort of level of involvement from people with different interests, you increasingly talking about or including more political elements in the sort of co-creation process. And this is also a reason why often, for example, hospitals or etc., are not keen to engage in the process because they might perceive that it could have some consequences from which they're not sure whether they work how it will develop, and they say no. We're not sure whether this is benefiting us or have any consequences. For example, to show that the complexity with, if you're looking for co-creation from a systems perspective, the complexity multiplies, including the sort of political interest and etc.
But if we compare, for instance, to drug development, one of the key tools there is, of course, also that we have fairly well-defined governance structures that tells you how you can actually do that, allowing the hospitals and then the pharma companies to interact in a way that is not always necessarily governed by trust, but at least it's governed in a way that enables the development to take place by having these outside governance structures that make sure that it's not the individual interaction between the company and the hospital or the doctor or the user that guides this, but that there is a layer of legislation, of ethics, of governance that ensures this. Is that then perhaps something that we're missing also in the digital area? Some of those governance systems, processes that can enable the ideation or the innovation.
Yes, there are definitely commonalities, or it could be analog, because one of the other elements I wanted to raise or aspects for the discussion is that because this sort of healthcare transformation and improvement usually involves this sort of system aspects and complexity for co-creation, that it has to be somehow be supported by a structure and a sort of coordination. Because of this complexity in different levels, from operational level, floor to floor interaction towards more health systems level. And so this requires a sort of moderation or coordination, or at least a sort of framework on how does it work with these different dimensions, rules, regulations, finances, besides the sort of more practical operational elements. In order to make the sort of co-creation within a system more easier. So that's definitely what I'm advocating, because the bottom-up approach, as what we saw in many sectors, not only digital but also in other innovation programs, that alone is not sufficient to get the solutions to the patients. And you need a systems approach from top down, but also from bottom up together.
Well, it seems perhaps then fitting because on my list of sinister questions is actually one that, of course, you mentioned, of course, the extra need to focus on tools that might help diagnose or support in the fight against infectious diseases. So. A good question, I think. Some of the processes that you described, how have these then been affected by Corona? Both the innovative side, but also the co-creative side, perhaps. Has this? I've failed to sort of use the word. Has this been a positive experience? Maybe.
Well, it's definitely has. So during the pandemic, you saw the uptake of digital tools to communicate and interact, both from between doctor and patients, but also among healthcare professionals. Really had a huge uptake, and that's a good thing because people can experience on it has a benefit in some ways. Also, that maybe a situation where it probably not is desirable to have only digital interaction. So I think this is a very valuable experience and also made organizations and people think, okay, how can we continue this in the post-pandemic period? So that's a good thing, and there we maybe should capitalize on. But what you also see is there all kind of companies, innovators are claiming, oh, this is the big breakthrough. This is really the change where we have waiting for. Well, in most situations, we're only talking about digital communication using an app, a sort of Skype or Teams or WhatsApp for people to communicate. And this is already a sort of benefit. But if you're thinking about healthcare processes in order to improve them, it takes a lot more than just digital interaction. And you talk about all kind of processes which need to be supported, decision making, multidisciplinary teams, care pathways, etc. So this sort of idea that, okay, if we are using a digital communication app, we have revolutionized healthcare. That's not true. So it needs a real integration in care processes, both from a professional point of view, but also at the patient side. And this takes a lot more. It takes a systems approach to redesign the sort of care processes and include digital in this process. Because I think it should start by the improvement of the actual care process, and then digital should feed in. Or you could of course, you can look to digital sort of characteristics or functionalities, because they also have implications for how you could provide care. But sometimes through the eyes, I think, of industry and innovators, they think, oh, digital will solve it all. This will change healthcare, and that's also by evidence not true.
It's clearly that the email is not the solution for all our postal problems. It has other pitfalls in that one. But thinking of the positive experience, and my deepest apologies to our participants for me using that phrase in relation to Corona. But would you say perhaps that what we've seen it would simply be described as an acceleration of something that would have happened anyway, just us seeing something that would have happened in 5 years or so, regardless of whatever happened? Or are we talking about perhaps a sort of a really an aha moment that transforms the approach here? Or maybe are we only, as you say, just adding a, Zoom to communication? That's not real innovation. That's only a
Yeah.
charade. So are we talking about a real, just an acceleration, a transformation, or is this? Are we stuck maybe halfway? Are we? So at this
Yeah.
point,
Well, looking a little bit at the current sort of actions following the pandemic and this also these changes in healthcare, I think it can be seen as a sort of encouragement. So we have seen or people seen some of the benefits, but if I'm following a little bit of discussions within governments, within ministries, etc., and you look, okay, do they realize, okay, we need to change healthcare as a system, and not only, okay, now we have digital tools, wow, our healthcare will be more sustainable, more resilient, etc. I don't see very much the realization and accordingly also the actions in order to start concretely changing the system. Discussions are currently ongoing. So there's a sort of, okay, yeah, we should realize, but the why I think is well defined now, and there's a sort of feeling of urgency. I think there are still a lot of things missing in the what. Should we change? And there's not so much about the how. So we saw plans over the last 15 years in digitalization, in integrated care, etc. And very little has been established. And it's
mm.
also important for people to realize that despite
So
all the knowledge, examples, good practices, there is still a major change to happen. And all these innovators and digital advocates over the last 10 years, if you see what's actually is realized, is in terms of
mm.
improving patient care, it's not so much actually.
No, so I mean, what I was trying to say was that unless you are really careful, same old will definitely beat innovation every day. You have to be vigilant that the positive experience or the learnings can actually be transformed into actual change. Um, but are you thinking of these as um, just forces of habit, or are there real barriers that I mean, is this simply because well, I mean, habits can be nice to have, but they are not necessarily evil by nature. It's just a force of habit. But we're talking about barriers here. Are there also sort of elements that we should be mindful of outside just simply the reluctancy to transform? Because well, habits are nice. Or what do you describe these barriers as being? Are they active or just simply a state of mind?
Well, obviously, there are numerous factors involved in the sort of why it is so difficult to transform systems. So habits or vested interest is one of them. But there are a number of reasons. Health system change is complex, but the good news is there are also important lessons and good practices from which we can learn. But the one of the important realizations is that often also for relatively small service improvement or operational improvements, you need system changes. So this whole idea, what has been quite dominant in the last decades, was if we change some of the pieces of the puzzle, if we turn some knobs here and there, we can maybe achieve improvements here or there. And that's simply not true. If you really want to improve healthcare, it often requires a system change, but this is complex and it might take a while. So typically, this is also something which is for politicians or decision makers is often not so attractive because, yeah, it's riskful. You cannot achieve maybe good results on a short terms, or if you have 4 years in government. So these factors are also are playing a role when it comes to policies and implementation. And European Commission, happily, they are quite have a longer term view on this. So they have good programs and content available to make that happen, and also collaborations, which you also need for system change. But I should say it's the sort of comprehensive approach and co-creation which makes it difficult.
Would you say that then, I mean, for that system change to happen, or for the, I don't know, the realization, the the turning point to happen, that co-creation is actually that is not just part of the process, but can it actually then maybe accelerate that process? Can it play a positive role? Will bottom up be able to simply by force of numbers, if not power, be able to be a positive force in that transformation? Is that one of the ways that we can use co-creation, you think?
Yes, no, I think, and that's also my personal experience. This co-creation, engaging with relevant people to rethink or to create solutions, I think is a very obvious thing to do because co-creation keeps people committed. They have the feeling of contributing. So there are so many elements which are important for people, which also is the sort of how you can make sure the eventual solution is adapted. Because if people and professionals, etc., have contributed, they are more likely to adapt also those solutions they developed themselves. And this can be done on different levels. So co-creation on very simple concrete products is one. On services provided in a particular setting, local setting or regional setting. You can also co-create with regional stakeholders, but you can also do this with payers, regulators, etc., in order to make them understand from if you want to achieve this or that at a more operational level, you need to change this or that, and accordingly how you do that. So that instrument of co-creation is very powerful, and this is done everywhere in the world. Russia, I think, is quite innovative in using this in policy making. Maybe surprising, but they do.
I plead the amendment. Yeah.
Sorry.
You work much more in Russia. It's fascinating to then to get that insight. Actually, I know that well, for our audience, that when Nick and I have discussed digital health at the WHO Europe headquarters, a strong proportion of the participants there are, of course, also from the Russian Federation. But it's a rare sight, of course, in the European Union that we have participants from Russia. But it's worth thinking of, I suppose, as that is as also an inspiration, a force for inspiration in terms of process as well. Nick, very very
Yeah.
useful. How do then? What do you think? Maybe you use it as co-creative in the political process, but is there a particular trick you think that the Russians are good at when it comes to the co-creative process? Is that a
Well,
cultural thing or?
well, in general, I think the people in Russia are well trained, also from a more beta perspective. So I think you could say that they are a bit more technocratic oriented than, for example, the Netherlands, which is more on social and service in terms of sort of maybe culture from education. And so the sort of basic skills in understanding systems and mechanisms is well represented in people. Um, and because the sort of co-creation collaboration is an issue is a thing which is well, maybe a bit new or not new, but I think it's less common than we have, for example, in the Dutch culture in communicating with each other, etc. um, they make a good benefit of, okay, this is something which we are, well, maybe lacking in some sense, and which they adapt in a sort of strategy. And also had a sort of leadership, it's more top down. And so when they say, okay, we're going to do this, then usually organizations align and people align. So there you can see that they are quite talented in making fair use of existing resources and adapting new, like they do in China. But China is doing this again in a sort of different way, but also very strong in um, well, making digital projects, initiatives, and for example, healthcare, quite successful according to their culture of how they work.
Mm. What you're describing is also, isn't it really also a matter of the fact that if they have a higher level of digital health literacy, even though it might not be, um, as you describe it, it might be stemming from a more technocratic approach, but if the people that you're working with have a higher digital health literacy, then that actually also extends the power of the co-creation, perhaps. So it's a
Mhm.
win-win situation. Um, but when using co-creation, then what are then maybe some of the pitfalls that you would point to? It's things to be especially conscious of, so that I don't know, so that you use the proper level of respect or others. Are there things that you think that we should be conscious of in a process of using co-creation more?
Um, well, I think maybe especially in healthcare. So uh, the process of co-creation, especially if you go beyond the single element, the single solutions of an interface or a product, it requires a lot of time and investment in order to make it successful. Because understanding situation of patients or a professional in a complex setting takes time. And so this is more like a longer term investment on understanding and also the creating the solution and the implementation. Um, take, for example, a sort of behavior change approach from a people's perspective. So this is not only, let's say, dependent or successful with an app or a watch, because human nature, human behavior is typically very sensitive for the context and the environment. So in order to, if you want to make sort of digital solution of part of the solution, you also have to take the context in consideration, and also probably have to change and adapt the context if you want to really be successful. But this is obviously far more complex than developing an app or a watch. So the pitfall is that, for example, industry is saying, well, we have a personalized approach and we give you personalized data with our solutions, and just buy it and you will be happier and slimmer and whatever. Well, the real solution is in a different direction. So, and that's coming back a little bit to my phrase that sometimes it's used just more for the marketing rather than it's really an approach to change and improve the situation.
So a key reminder here that when you try to co-create with patients, you need patience. Yeah. Okay. But we're conscious of the time a little bit here, Nick. I would perhaps also, if we look slightly ahead, also some of them it might be some of your own, but it can be some other cool cats out there. What if you should mention a few projects or experts that you really think you are turning towards or inspired by in at the present or in the immediate future? Who would you point to? What's your inspiration, really?
My inspiration
Is it actually an inspiration within healthcare? Are you looking towards other sectors for inspiration, maybe?
Yeah, well, I think you have to separate my general inspiration or motivation and the professional one. So in general, my inspiration, my general personal inspiration, does come from different angles, from music, from novels, from art, often not very healthcare related. And I definitely, of course, I like what Steve Jobs has done and Elon Musk, but basically, I don't care shit. No, but so inspiration in general, I think it's important to if you have a more free, open mind, you are better able to also find solutions for specifically maybe professionally. So professionally, I get a lot of inspiration also from achievement elsewhere. So I said I work a lot in China, and if you see what in China is happening with digital platforms and how they want to transform healthcare for a huge number of people, it's quite impressive what they are doing. And typically also in their approach, because it's very different from Western European, Western world approach, typically the Netherlands. And so that gives me a sort of different angle to look at the same problem. Same in Russia. It's also, Russia have, it's quite similar, I think, to us, but they have this Russian approach. So this sort of different way of how to approach things, which I really like, and it's also it gives sort of information, examples on maybe how to do differently, and learn from that and translate to other context.
So key advice maybe to look for advice also outside the European Union.
Yeah.
So, but perhaps if I'll allow you to be pessimistic a little bit, what would you describe as your biggest fear for digital health? I mean, either in 2021 or in the immediate 5 or 10 years or so. What would be a scenario that you could see happening that you would be well, negative towards, fearful of?
Well, I think, and it's an issue I have well talking already for some years, and that's the sort of marketing overhyped talking about solutions for healthcare
Mm.
with all kind of like blockchain,
Mm.
artificial intelligence, and virtual reality, and although they are sort of innovation tools, technologies which could have their benefit, but by overstating them, overhyped, using a sort of marketing approach to promote products or organizations or consultancy talk is diverting us from the real problems in healthcare. And already we see a lot of investments in digital and data and artificial intelligence. But we know, if you know a little bit about mathematics and about the
Mm.
limitations we have with all these prognostics and etc., and the the problems you have with sort of using these tools and technologies, and that they often not give the sort of precise answers which are claimed for.
Mm.
You're probably missing out on other huge topics where maybe some investment in time and money could have been more beneficial.
So
Um,
techno fascination, maybe. Yeah. But on the other flip side, the biggest hope, maybe, that you have at this stage. I mean, I'm conscious of the fact that we are living through a pandemic, but it's nice to talk about hope. And what are you really hopeful about? Or
well, I think sure, there's a vast uh, number of people and younger generations who do realize, okay, we have to change and do something differently. Also considering environmental issues, but and I'm getting very encouraged by younger generation in a lot of countries who thinking standing up against the sort of old style vested interest, old generations who want to keep things for themselves. Or so I think the sort of idea we have to change is becoming stronger,
Mhm.
and this is also relevant for healthcare. Um, and definitely, I think there's a sort of benefit from technologies and from digital, etc. So if we are able to have this sort of feeling, okay, we have to change in this movement, could combine it with a more sensible way how to define, okay, what's the path towards better healthcare,
Mm.
and with a sort of leadership in order to make it happen, then I'm quite optimistic.
Would you say which of the two is the sort of the primary direction that we're heading in these days? Um, do you think mostly that digital health is heading the right way?
Well, it's quite inconclusive, I think, for the moment.
Okay.
So it's to be seen, and what I said before, it's very much dependent on how leaders are willing to change healthcare systems, and starting from the point of view of the patient, the professionals, the operational issues,
Mm.
rather than uh, claiming, okay, we use innovation to solve the problems in our healthcare system. So,
A
it,
very fitting ending remark, Nick. Indeed. Depends on how they choose to perceive it and what direction our stakeholders choose to take digital health. It's been a pleasure, Nick. I look forward to seeing you again, physically as well, or in a physical space in the future. I'll thank you very much for this first of the Got It Talks. Thank you very much to our participants for their patience. Patience is a virtue, and also in co-creation, it seems. And we'll look forward to continued talks happening next Wednesday. But I won't be seeing you, Nick, next Wednesday. But hopefully, sometimes in the digital future, we will.
Thank you very
Thank
much,
you.
Lars, and thank you very much for listening, everybody. See you soon.